For Congressional Perspective, we're joined now from Capitol Hill by two members of the House, Representative Raúl Grijalva, he's a Democrat from Arizona, and Representative Peter Roskam, the GOP Deputy Whip. He's from Illinois, and he was in the courtroom today. Congressman, thank you both for joining us. I want to just start by asking you both, I want to try to take your temperature. Representative Grijalva, how are you and your allies feeling after 3 days of these arguments before the court? Are you feeling as if the law is going to be upheld and it's going to go your way?
Yeah, I think the sense of optimism is always difficult to gauge, but I think we have history on our side. Every time there has been a point in this nation's history, whether it was the issue of civil rights, issue of education and access, the Supreme Court has stepped that kind of case, with historic implications, and because of history, I feel that the court will do the right thing.
And Representative Roskam, what about you and your allies? Let me take your temperature. Are you feeling that the case, that the court will do, the majority will go as you want them to, and that is strike the law down?
Well, I'm feeling like most Americans are. According to the New York Times, only 1 in 4 Americans thinks that the court should leave this law intact. And I think most folks, the more they've found out, they've been disappointed in it, and they want to see it repealed and replaced. So I was at the hearing this morning that was focused in on the severability issue, and based on the nature of the questions, and I know it's dangerous to speculate and to overinterpret, but based on the nature of the questions, I would be surprised if the law comes through with the unblemished imprimatur of the United States Supreme Court.
Well, staying with you, Congressman Roskam, practical consequences. If the court rules that the individual mandate is unconstitutional and either much or all of this law falls, what happens?
Well, then Congress has the opportunity to revisit it, and I would argue to do that in a more thoughtful way. One of the criticisms of the passage of the bill originally was it didn't get the type of vetting that would have been helpful to create a consensus to drive forth with 2 major themes. And this is where I think President Obama missed an opportunity, and that is to focus in on cost reduction, dealing with pre-existing conditions in a patient-centered way. So if the court strikes down the entire bill, we generally have a national consensus that says we need to revisit this and put these themes in place, and I think that we can do it, but we can do it in a way that doesn't have an adverse impact on doctor-patient relationship and doesn't have an adverse impact on cost, which you've just seen, even according to the Congressional Budget Office, is accelerating at a rate at which they didn't actually contemplate.
And Representative Grijalva, let me put that question to you. If what the court decides is to say that the individual mandate is unconstitutional and they knock down either much or all of the law, as much as we've been hearing the last few days, what do you think the practical consequences would be?
The practical consequences that we're still dealing with the reality. 45 million people uninsured. This law would take us to 30 million that would receive insurance by 2014. Pre-existing conditions as a denial point for insurance is prohibited under this law. Kids under 26 still being able to be carried by their parents and their insurance. Community ratings so that insurance companies tell the community why their premiums are going up. The 80-20 rule that 80% of the money that insurance companies get must go to patient health care. And then I think the most important thing is beginning to strike a balance. You know, this whole law was about a compromise. The individual foundation idea and Newt Gingrich. So as we go forward, I think it'll be a big win if it's struck down for the private insurance carriers and a huge loss for the American people. We'll see more uninsured, and we'll see prices go up and up regarding health care.
Well, let me come back to you, Congressman Roskam, on that point. If that's a pretty dark scenario that your colleague there is painting, why wouldn't that be the result if the court knocks much of this law down?
Well, let's put it in the totality of the situation. President Obama, when he was advocating the law originally, said that you'd get to keep the coverage that you have if you like it, and that's turned out not to be true. He said it was going to be a cost saver. That's turned out not to be true. I have constituent companies and small businesses in my district, Judy, that have said that they are unwilling to expand their business and hire new full-time people based on the adverse impact of the cost of this new health care law. So I think where Raúl and I would be able to come together is to say, look, there's nobody that wants to defend the status quo. That is, you can focus in on things that drive costs down, which makes health care more affordable, and you can focus in on funding high-risk pools that deal with pre-existing conditions. And I think that there's a very thoughtful way to move forward. It's my hope that... Go ahead.
I was just going to say, I want to ask you about that because Justice Kennedy even referred to that today. He referred to the ability of Congress to come together if the court decides to knock much of this down. He said reworking health care, if they did that, would fall to, quote, the real Congress or a hypothetical Congress. In other words, raising questions about whether Congress can come together on health care, on questions of health care.
Look, it's incumbent upon us to drive towards a solution that I think deals with two core themes. That is, getting health care costs so that they're manageable and predictable in a positive way, and dealing with the cumulative social cost of dealing with pre-existing conditions. I think that we can do this, and I'm absolutely convinced we can.
Congressman Grijalva, let me just turn, frankly, to a purely political perspective. What happens if the court knocks much of this law aside or down? What does the Democratic Party do? What does it mean for President Obama?
I think what the Democratic Party does in Congress is if it's struck down, is to pursue the agenda that we started with: affordability, access to health care for the millions and millions of Americans that don't have any insurance or coverage. And with that comes the attention of the American people on Congress to see what we craft. And I would beg to say that the fundamental differences will access, coverage, and cost controls. They continue to be preeminent in this whole debate. And if it comes back to the House, then the American people will sit in judgment about who is trying to extend the benefit to the majority of the American people and who is restricting and listening to insurance companies in terms of what direction to do health care. We've listened to them in the past, and this is why we have the mess we have. But
Representative Grijalva, staying with you, how much, though, would the president be hurt politically if that were to happen? He's right. This is a centerpiece, domestic centerpiece of his administration.
I think the president would have to rise to this occasion, and he has in the past. I don't see it as a direct damage to President Obama. I see it as I think the American people will see it as a direct damage to them and to the cost that they're having to incur with health care. Crafting a different solution becomes the problem of Congress, and the president will have a huge role in resolving this issue one more time.
Conversely, Congressman Roskam, if the court does decide to uphold the law or say it casts aside the individual mandate but says the rest of the law can stand, what does that mean politically in this election year? Well,
so there's two questions there. If the law is upheld entirely by the court, and I don't think that's likely, but if it is, then you would have ultimately a referendum question this November where the country says they either approve of that decision by the Obama administration to enact this law or not. And that will manifest itself in the course of the presidential campaign. Now, if they strike down part of this, so for example, if they strike down the individual mandate and leave the other pieces intact, then you've got a huge funding problem, and I would suggest that that is an outcome that would please nobody.
Well, gentlemen, we are going to leave it there. We've got a little time to think about it until we know what the court does. Representative Peter Roskam, Representative Raúl Grijalva, thank you.
Thank you.